So I guess the best way to learn is really to hear my story, which is obviously still not over yet. I'm still doing a lot of work and building my brand, my business. But back in 2007, 2006, I was thinking about some sort of side business. I was an anesthesiology resident at NYU. And back then, we didn't really all have these smart cell phones. A lot of us even had Palm Pilots, and I would sit there on call and I would think of different ideas to start a business, a side business, because I always knew I had this entrepreneurial spirit. I didn't want to get rich by just more and more cases, or just, I didn't look at being a doctor as a way to get rich. I looked at it as a way to make a nice, comfortable living. But I didn't want to look at patients with dollar signs in my eyes. I didn't want that type of practice. It's very satisfying to do the right thing for the patient without thinking of them that way. That being said, I started to think of what type of business could I get into, which would pay me while I am sleeping, pay me while I am doing other things with my family, with my kids. So I was always writing down these different ideas, and brainstorming is the best thing. You write down anything and everything you think of, and then you slowly eliminate by what's realistic, what's not, what may be too costly to start up, what you may not have the knowledge to do, or you do have the knowledge for. And in the end, I started my fellowship in NYU in 2007, and I realized that there was no question book for the pain boards. Maybe an old book 10 years old from the 90s, but nothing relevant. So I decided to write a book. And this being the digital age, I quickly changed my mind and said, well, why don't I just put it all on the web and do a question bank? That was the most sensible thing at the time. So I found a guy from Cameroon for $600, created me my first website. And I invested, I don't know, maybe a little under $2,000 to start the LLC and some other costs. Back then, this is before Facebook, I believe, or at least before I was involved with Facebook or any of these social media channels. I was scouring the internet for the program directors lists. And while I was, after I put all the content on the web, and when I was ready to go online and start the business, I emailed all these program directors I could find. And within 2 months, I not only made all the money back, and I wasn't even charging so much per membership. I showed up on the first page of Google for a spot for pain management board review organically without any paid advertisement. And that just showed what a deficit there was. And back then I was saying to myself and to my friends that the internet was in its infancy. The internet is still in its infancy, in my opinion, right? This is going to be around for as long as mankind will be around, probably. So there's still so many things that have not been done, so many businesses that haven't been started, so much potential out there. So that being said, I had this website now. It was making money, not really doing much with social media yet. And I said, wow, this worked great for pain doctors. Why don't I create one for anesthesiologists, for CRNAs, certified registered nurse anesthetists, for pain management nurses, palliative care physicians. And the reasons why I chose these specialties, aside from the fact I'm an anesthesiologist, because there's overlap between pain, anesthesia, physiatry, for instance. I sat there, I read the physiatry textbook, I wrote questions, I created an online board review, PMRExam.com, pediatric anesthesia. I had about 9-10 websites. And over the years, I learned that this does require a lot of work. So A, you need to make sure that you really love it and you're into it. And B, web developers are like contractors for your house. They're good until they're not good. They all have most of them have an expiration date. I'm hoping my current one won't, because he's been fantastic so far. But there's a lot to dealing with people who are working for you. And us doctors, we don't really, if we're going straight from college to med school to residency, we don't have this business education. We need to get it along the way. And I'm part of a large practice now. So I'm a director in my practice. I run a lot of the financial aspects, but I still don't control HR. I don't control the finances. So I don't have the experience. I think, dealing with the paperwork of workman's comp for your employees and all that. So this side business gave me that direct experience, and I eventually grew and hired an employee who was fantastic, but she had some health problems and she had to leave. So I learned a thing or two about the whole employment law thing. It was a mutual thing when she left. It's just that you need to kind of understand certain things when you're hiring people. And if you're in your own practice, you know that already. If you're running it yourselves, that is. So moving on, I did start getting into Facebook groups and whatnot, and I still didn't make that investment into social media because it's very time consuming, I found. And I found for me, the easiest way was when I started to develop my podcast and get involved with my newsletter, which I developed maybe 6 years ago, the PainExam Podcast, the AnesthesiaExam Podcast, and the PMRExam Podcast. And what these programs do is that when you're publishing your podcast or even a newsletter, an e-blast, you could also at the same time publish on Facebook, Instagram, Twitter, whatever the program is configured to, which saves a lot of time. So that being said, I was able to grow this business first by starting by doing a lot of legwork while on call, and I had downtime. Then with my commute, I have a long commute to my office in Brooklyn, so I would start my day 7:30 a.m. I'd get there 6:30 a.m. and I would work for an hour or so. Anytime I had downtime, I would keep working. So the business grew. And over the years, I was fortunate enough to be in contact with industry, to get involved with some advertisements for industry, surveys for companies such as Boston Scientific. When you have an audience or you're providing a service to the medical community or even patients, somebody's interested in getting to you to access that group. And basically, I was able to leverage my audience, and leverage is a big thing, right? You want to be able to leverage what you have to get something bigger. So about 4 years ago, I went to one of these conferences. It's called ASRA, American Society of Regional Anesthesia, and they have vendors there, right? And one of the vendors had this really unique ultrasound probe. So I started talking to them. They were fairly new, small company. I was looking for a long-term relationship, not the quick money. And what happened with this is I became a consultant, and they gave me one of their newest units to test out. And the beautiful thing about this is, for someone who's producing ultrasound guided nerve block videos and tutorials, I was able to create content even faster. And I could share some of that with you, because part of my business now is teaching. So let's see if I can figure out how to share this. Okay, so
there should be a share. I don't know if it looks like mine. I'm sorry to interrupt, but there should be a share screen button on the bottom, and you double click and then it comes up.
Right, it's telling me to go to, it's giving me a system preferences. Let's see if I can just figure it out.
Oh yeah, you've got to have your system set up. That happened to me the first time I ever did that.
Yeah, it should take a second.
Okay,
Sorry,
yeah,
guys.
No worries. Those of you that are watching, give us a heart, give us a like, get some, traction for David, for his putting his time into letting us into his experience. David, I also, by the way, I love what you're doing, and I'm writing as you speak. I do have the ability to flash things underneath as you speak, but I noticed lately it distracts the speakers. So do you prefer that I don't? I like to summarize.
I don't mind. I'm fine with that.
All right, let's try it. Let's try it. Guys, if you're watching, Dr. Rosenblum's taken some time out of his super busy day. He's an anesthesiologist and pain specialist. He's taking time out of his day to share with us how he got consulting opportunities by starting a business. So, thank you so much. So people are weighing in, but they just, FYI, they look like Facebook user because they didn't give permission to StreamYard, which is totally fine. If you're watching this and you're loving what Dr. Rosenblum's speaking about, first of all, give us a heart, because the hearts help. Secondly, let us know. Thirdly, ask any questions you want at any point. It doesn't interrupt, and we will be having a Q&A session afterwards. And then additionally, say hi. Let us know where you're coming from, or vote in the poll that I asked earlier, which is let us know if this series, which is new, this is the first one, so it's kind of wonky. Let us know if you want us to call it Physician Thought Leader series or Physicians Teach series, because it helps me to know what resonates with you all. David, did you
Can I
fix
say
it?
what I think? Yeah, I'm getting 16 right now. I
Absolutely.
found it. I think physician thought leader.
Okay, Physician Thought Leader
That's,
series.
I think because we're all teachers. I think thought leader is a little bit, I don't know. I think a little bit more. I think maybe I got this. Hold on.
Did you get it? Because I'll step off.
It was already, the problem is it was already clicked, so that's what I'm concerned about.
Perfect.
No, but then it wasn't.
Technical difficulties, guys, which we will fix in a minute shortly. And
screen recording. That's fine.
now, Dr. Carrie Wilkins is coming at 3:30 to teach us about webinars, but Dr. Rosenblum's teaching us in a minute. Ooh, we've got a live viewer from Antigua, Barbuda. Wow.
Oh, wow.
Amazing. All right, very cool. Let me know where you guys are live watching this from. All right, David, you good?
Try again. I don't know. Let's see.
Sure.
Share screen. Okay. Can you guys see my screen?
No, we can't.
It says they're trying to share my screen. Give me a second.
I'm sorry. There we go.
Okay. You got it? Okay.
You're good. You're on the screen.
You're seeing my screen? Excellent. Okay. So first of all, I just wanted to walk you through what my website. I hired. Okay, rewind. I was dealing with a web developer all these years, and I have a CME review, as you can see here. And my old website had a lot of data on a lot of doctors in terms of CME, and I was scared to leave this web developer, and I was paying him every month. And I was basically, I felt like a captive because I just didn't know who to go to, because I've dealt with the cheap guys from different countries. I've dealt with expensive people here, and I never really was satisfied. Never felt like I was getting either value or security. So through a recommendation of a physical therapist I used, I hired a newer company who was more costly, but at the end of the day, if they give you better service, better quality, you get what you pay for. And I'm very happy with them. I mean, it's not even just the design of the site, the functionality, it's just the service. So what I've been doing, and you could just see on the top of my website, and because this is a real good template for me to go over everything I've been doing, because I think it's going to help you guys see the way I think about things. First of all, over the last 2 years, starting small, I started to approach state societies, state pain societies, and I realized I had all the fellows coming to me for board prep. And then when they graduate, I still have their email list. I'm growing my newsletter. Right now I have about 10,000 active emails. In terms of the amount of that are strictly pain doctors is about 3,500 pain doctors. So imagine how valuable that is to a company that produces either a pain medication or a spinal cord stimulator product. So I approached these companies, these societies like North American Neuromodulation Society. And to my surprise, they were very receptive right away. They gave me their boardroom to do podcasts with their faculty. So I started interviewing their faculty, and every big name in pain introduced me to another big name in pain. So before I knew it, I'm rubbing shoulders with the top of the top. And I then used that to leverage myself through the networking to other societies. And eventually I came into contact with the Eastern Pain Association, the American Society of Interventional Pain Physicians, NASIPP, CalSIPP, all these other Tennessee pain societies, New York State pain societies, all these other societies. And we've been leveraging each other's email lists to market for each other. And my business model has been more of sort of altruistic, but there is a benefit to me, is more of, I guess, symbiotic. I'm not looking to make money off of the nonprofit pain societies. I make my profit by selling board review and courses to physicians, as well as advertising space, consulting to companies, or doing market research for companies who want to know what my docs are thinking. So I basically developed very strong ties to these companies, these societies, excuse me. And for instance, ASIP's been great, and the head of ASIPP, Wax, and I'm also in, have been fantastic in not only helping me market my courses, but also allowing me to affiliate with ASIPP. ASIPP is one of the best and most respected pain societies when it comes to interventional pain. So by having them on board, it gives me and my brand another level of credibility, and that also helps with the marketing, as well as consulting. I recently was invited to be a part of the WAPMU faculty. WAPMU is the World Academy of Pain Medicine United, used to be ultrasound, and they teach interventional pain courses. So there's a lot you can do. When the pandemic started, I created the virtual pain fellowship, which I left for free for current pain fellows during the beginning of the pandemic, and that was until July. And through that, not intentional, but if you see here my landing page for this, the doctor needed to put down their program director's email address so that they could verify that they're truly a fellow. And lo and behold, what was happening was I was getting all these emails from the fellowship directors, and this is a pre-made email, meaning I made it very easy for them. They put their email here, and I wrote out a paragraph, and it just gets sent to me, so that they didn't really need to put much effort into this. And before I know it, I'm growing my program director email list with the most current program directors in the country, which is pretty valuable for a doctor who's selling board prep, right? So that's one avenue I was approaching. The other was the CME credits. I don't know if you guys have ever run a CME credit webinar or any sort of activity. It could be very difficult. I've been blessed to have a very supportive hospital and CME committee, and basically they've been supporting me for over 10 years doing this. And of course, I have to be very careful with all my affiliate agreements and all my consulting to disclose that or to keep it completely outside of the activity, but it's worked out really, really well. Next, I've been able to use an events page to leverage all my activities. So I've been doing a lot of webinars since the pandemic. My most recent, which I'll give you details about and may or may not be relevant for your practice, is the ultrasound guided webinar this Sunday that I'm doing. I've become I guess, consultant or more of an advertiser for Silex Pharmaceuticals. So I have a banner ad on this page, as well as I help NASIP with their talks, their webinars, promote it, and created my own regenerative medicine for spine disease course. I'm also going to be teaching a regenerative medicine course for American Society of Interventional Pain Physicians this weekend. So it's led to a lot of cool things, and I've branched out quite a bit. Now, a lot of people ask me, how do I have time for all this? Remember, I'm doing this for over 10 years, and I put a little bit in, not every day, but almost every day. And on top of that, I give personalized service, unlike my competitors, who I'm going up against big companies, major publishing companies who produce their own board review for pain doctors. And the only thing I really have that I think of as being a big advantage that they don't have is I'm flexible. I'm more or less a one-man show. I have my freelancers, my web developer people I hire, but at the end of the day, if I want to do something, I do it. I don't need to get permission or have a meeting. And it's really nice to have that flexibility. On the other hand, it can be a little overwhelming when you're doing it by yourself. I've also had my web developer create this news page where I could keep doctors afloat of what's going on in my YouTube channel, where I'm teaching doctors diagnostic nerve blocks for cluneal neuralgia, or I'm interviewing acupuncturists and people who specialize in pain or other disease or other specialists who do other things. I also have articles, blogs I've written, podcasts, of course. This week I published a podcast on the PENG block, which is it's a nerve block for hip pain after a fracture. So the idea is to produce, but also do it in a fashion that you're not going to drive yourself nuts. So I recently started to have my web developer create and release the podcasts, and it's a good thing I did because he's doing a much better job than I was. He's He's focusing on my brand. So we're getting rid of the old podcast album cover, which you saw on the previous page. And he's been doing all of this work here, which I think it looks a lot better than what I used to have on the page. This is something I created. The rest of them are things I created. I use a program called Pixelmator to create this. It's very useful. I use MailChimp to run my email lists. I use Eventbrite and Zoom to run my webinars. This is my webinar that I'm doing on Sunday. And I'll give you a discount code at the end of this talk. So you guys get 30% off if you're interested in learning pain blocks or regenerative or ultrasound to guide regenerative procedures. This is another webinar I'm doing for the ultrasound company. That's a picture of the ultrasound. Okay. I've also been invited to give a webinar for the for Claris, for Sprint, which is a peripheral nerve stimulator company. I'm doing that next week as well. So I've been very busy, and I think the key to getting these consulting opportunities, you don't have to have a large audience like I do on the website. Everybody has their own path. Some people are very academic, some people publish a lot, but I think a big part of this is going to the meetings, meeting the reps, trying to present at the meetings, even if it's just a poster to start with. You want to be a go-to person. Maybe you're adventurous and you want to try applying a technology to for a new indication. For instance, you want to use a spinal cord stimulator or peripheral nerve stimulator for something different, or a drug for something different. If you're thinking outside the box, or if you have a large social media following, you have something very valuable as a consultant. Remember, these companies, these drug companies, they would pay, I don't know, anywhere from $2,000 to $10,000 just to put on a drug dinner. Okay, how much does it cost to sponsor a podcast or to put a banner ad up like this? I mean, it varies based on who's doing it, but these numbers for the amount of I guess the amount of people you have on your platform, that will dictate how much they may pay for it or how attractive you are. So there's consulting, and then there's being a conduit or a way to advertise for that company. And I guess I'm more than just a consultant. I do this. I consult for Pfizer as well. They saw all this work I do, and they're interested in someone who could bring this sort of, I guess, background to their company. I signed an NDA, so I can't really talk about what I'm doing with them. But it's in the realm of creativity in terms of creating something academic. And I mean, there really is a lot that I'm not even touching upon. I could talk for longer, and I'm really not sure if there are any questions at this point. But I think the future is still open with this. If I had more time, I would be doing more things with my platform. But of course, we're limited by time, and at some point, you may need to hire people and branch out, and you may take a financial hit. You may have to invest money instead of make money. But you know, one point I'd like to bring up is, you know, working with this company, Claris, not only did they give me the ultrasound, but they also paid me to do things with it. So, you know, if you could create some sort of platform that is that valuable to a company, they've also created these high quality videos that they're using, but they gave me permission to use for my presentation. So I think there's a lot that can be done. And if you guys have any questions, if you're trying to start something up, I'd be more than happy to talk to you. If you are not aware of my podcast, definitely check it out, because almost all of us treat pain on some shape, form, or another. Even if you're a pathologist, you might be a relative who's in pain, and you could learn something. As well as if you have any desire to do any sort of image-guided or ultrasound-guided injection in your practice. I know not just anesthesiologists are coming to my course. I see physiatrists, internists, people who want to do PRP, which is a big deal now. PRP, I used to think was something that people did just to make money, and it was, you know, the evidence was shady. But to be honest, there's a lot of good evidence, and it works. Not for everything, of course, but it's out there. And now I can honestly tell patients, hey, you know, if I was in your shoes, I would do this. It's not covered, but I would do this. More and more people are opting for this, and I'm seeing very good results in my practice.